Hello. I started on time at 9 o'clock, 7 o'clock UK time, 1900 hours, but I apparently my mic was not working. So I had to put a full stop to my conversation and restart again. Uh, I'm Dr. Hashmi. I'm a psychiatrist. I've been practicing for quite a long time, probably 30 years plus. Today, I have chosen to talk about neurodiversity. And neurodiversity is ADHD and ASD, attention deficit and hyperactivity disorder and autistic spectrum disorder. My plan is to hold three live talks on neurodiversity. The first one, I am going to focus on attention deficit and hyperactivity disorder. The second one will be on autistic spectrum disorder. And the third one actually is on the management of the conditions and few strategies. But I'm holding other talks as well on live streaming uh, when I'm going to talk about the strategies which are very useful for everybody as well as in neurodiversity, very relevant to it. Now, the reason I have chosen to talk about it that there is an influx of neurodiversity. There is an influx of ADHD. Waiting time in Britain actually range from a couple of years to up to 10 years. People are waiting and not being seen, and who needs desperate help, and if they have resources they are going private. Now, irrespective of the fact that I've been saying for over 10 years that the day NHS will be hit by ADHD and ASD, autistic spectrum disorder diagnosis, and their prevalence in general public, we will never be as an organization uh, be ready to serve the general public, and that's exactly what we are seeing now. This influx has cropped up some services which are not providing quality assessments. Hence, the purpose of my talk is that number one, understand what the condition is. Number two, if you are going to be diagnosed, a robust diagnostic process got to be followed. Number three, if you have the condition, it got to be managed effectively. And if you don't, you must not have the diagnosis. Now, mostly when you search on internet, you Google it, or you look at different psychometric evaluation tools, they incorporate 18 symptoms. 9 for attention deficit, 9 for hyperactivity. You tick the boxes, lot of times people believe you are ADHD. This is not where the story ends, but can be considered as the starting point. Psychometric testing is only a small part of the overall assessment process, which starts from initial assessment. It must always include developmental or collateral history, somebody who knows you very well, ideally the parents who have actually raised you from a very start. Because if it is neurodiversity, if it is ADHD or autism, it is there from the start, from the very start of your life. And there are symptoms and there are signs which can be picked up at a very, very early age. Number two, there is a huge difference between men and women, boys and girls. The system is more geared up to diagnose boys. Number of research studies being done. I was looking at one and it actually shows that the prescription rate at GP surgeries, they looked at it, in Britain, the the rate of prescribing stimulant medication to patients, and the boys were 85% and the girls were only 15%. Now, so the diagnosis doesn't mean that it's not present in girls or women. It is. I believe it is equally present, and I believe it is very frequently missed in girls. Why and how? Because we don't understand the condition enough. Secondly, clinicians tend to miss the soft signs. So today I am going through only focusing on ADHD. Next talk will be autistic spectrum, and the third will be about both how to manage it and why it is absolutely essential that both the conditions to be assessed together. That's the third talk on 3 consecutive Saturday evenings from 7 p.m. to 8 p.m. Now, let's talk about ADHD. In a very organized manner, if we think about it, and I'll take you through a specific system of 5 indicators. And what are those 5 sections or the indicators we are going to look at? Number one, physical, social, psychological, biological, and environmental. You can't think of the sixth one because these are the 5 aspects which covers almost everything. And whilst I'm going through each of them, you will realize on what stages and the aspects of it mistakes around misdiagnosis, overdiagnosis, or underdiagnosis are made. So the first one is physical. Now, physical restlessness, in simple words. It will be an inability to stay in one place. It will be hard not to do anything. You got to do anything. You got to do something. It does bring a kind of a need to move, a need to make a movement. You can't stay still. That is why even if one with ADHD is sitting quietly, not doing anything, you would see somewhere in the body there is a movement. Something is moving. Now, in boys, you see that movement more obvious because boys are generally more obvious. In girls, as far as when they are little, in their toddler years, you see hyperactivity more in movement terms, but still due to cultural differences, and those cultural differences are inherent. They are everywhere in the world. Means, irrespective of fact, whatever way you look at it, boys and girls within a family environment behave differently. We know that. So in girls, when they are small, when they are growing up, when they're in their toddler years, you will see hyperactivity very much like boys. But still in some conditions, inhibitions will be in place. Like in a class setting, 5, 6 years old, starting school, the boys will be more active, would not sit quietly. Girls will accept the authority of a teacher and the environment and the formality of the environment. They will sit a bit more quietly. So you won't see that level of hyperactivity in girls. But what you see is mannerisms. Mannerisms. This is one of the reasons clinicians and parents, and we all of us, miss ADHD symptoms in girls. And what are those mannerisms? They are going to play with their hair. piece of jewelry they are wearing, with the pen they are holding, doodling on the paper. Or they are zoning out, they are looking around here, there. Movement will be there in one form or the other, but missed, because girls will not be jumping up and down chairs in the table. They won't be pushing and pulling. They won't be throwing things. They won't be hanging with things. They would rather doodling. They would rather playing with the hair. They're rather playing with a hairband on their wrist. Now, physically, you see fidgeting, you will see mannerisms as I have described, very, very hard to pick in many cases, hence hyperactivity in girls is missed. Then you will see a need to move. Now, this need to move can quite commonly appear as grazing on food. And I'm going to tell you that is where the diagnosis gets wrong. In ADHD, the need to move may only present as, I've got a question actually. Is it okay for adults to have ADHD? Absolutely fine. It gives you super intelligence. Trust you me. It is super intelligence, man. And I'm going to come and talk about it. The concepts of neurodiversity is just not right, because neurodiversity is a blessing. If you use your level of intelligence instead of getting yourself let down with the baggages or perceived baggages, the progress will be limited. This is my third talk in my third session. Today is the physical. Now, I was talking about the relationship with food. The relationship with food will be like very much hidden in a sense if you're working in an office and there is a coffee machine somewhere. Every 10 minutes you are going to go and make a cup of coffee. People will think, oh yeah, I mean, it's like this man has so many coffee in a day. Solving two purposes. Number one, it's satisfying the need to move. Number two, it's also giving a bit of slight kick to attention and concentration. Because the symptom is hidden in the word attention deficit and hyperactivity. It is there. So it gives a bit of a kick of attention. So you get a bit more charge in your mind. And then it takes about 10-15 minutes to finish the cup of tea. And the more you are moving your hand, the more ADHD need to move satisfies. At home you are grazing. So if there is a bowl full of nut lying there, you are going to continue having it until it finishes. One thing after the other will go down in your tummy. Continue to go down in your tummy. Now this is ADHD. Very often you see grazing as a satisfactory element to need to move, misdiagnosed with eating disorder. Because it does not carry the rest of the diagnostic criteria required for an eating disorder. So the most common diagnosis individual get is eating disorder unspecified. Bulimia nervosa, not otherwise specified. As you cannot fit it into any specific category because the diagnostic criteria is not there, you got to put it down NOS, not otherwise specified. When even when you look at the bigger picture and understand the individual you are talking to, it will turn out to be a symptom of ADHD. Hyperactivity is expressed by way of grazing on food. Now, the another aspect of physical side of it is that the individuals are bound to get episodes of high energy, burst of energy. So they are going to get a day, maybe in a month, maybe in two weeks, maybe 10 days, depending on everybody. Individual is different because no two individuals are the same. A burst of energy, 6 hours of burst of energy, 8 hours of burst of energy, and you will see they are going to do everything. Everything which was pending is done. And you will be surprised, and they'll be very happy, and they will be very energetic, and everything is just getting done. Now, this happens episodically, and it lasts for a day or two, sometimes generally hours, half a day or a day. Now then what happens is it is followed by a period of loss of energy. So usually you have a one day full of energy where you have worked everything out. But the following day you can't even leave bed for a day or so because you are recovering. This is typical in attention deficit and hyperactivity disorder on the physical side of it. Misdiagnosed, usually misdiagnosed as cyclothymic mood disorder, a form of mood disorder, bipolar in some extreme cases, bipolar affective disorder. Or generally clinicians see it as a type of a mood variations, not otherwise described or classified. Now, it is a symptom of attention deficit. What makes the difference is that when you get the burst of energy, the priorities will still not be done. So if you have things, a priority list on your desk, which usually the part of hallmark of ADHD that you always have a priority list never gets completed, and it moves to another list the following day and the following week, and it just continue going list after list after list. When you get burst of energy, list never completed, but things which don't need to be done are all done. So this episodic burst of energy followed by a brief episode of loss of energy is sometimes seen as a mood condition, not ADHD. But if you understand individual a bit more in depth or more detail, you will understand it is a sign of it. So that is where you see the physical side of it. There is another thing about physical is you might see dyspraxia. You might see dyspraxia in a way that the coordination is not brilliant. They would love football. They would love playing in the field. They would love be outdoors as a part of their physical satisfaction. But sometimes they struggle to undertake a coordinated activity like push bike, riding on a push bike. So the coordination can be, it's called dyspraxia. So coordination can be an issue. Now, then, whilst I'm talking about dyspraxia, let's mention that it also linked with dyslexia, and usually children are the first thing you see in children, which teachers notice, is their struggle to understand and process the written text. So, spellings, sentence making, understanding, comprehension. Because of their high level of intelligence, a lot of times they know the answer but not understanding the question properly, or uh, processing of written language will be an issue, and that is called dyslexia. And that is usually the first thing. When I see somebody, they are generally diagnosed with dyslexia in their childhood or few years earlier to, to the formal assessment. So that's the physical side of it. Now talk about psychological side of it. So physical set of symptoms, what you see, then psychological set of symptoms. Psychological set of symptoms is the mind is always busy. It's a very busy mind. Mind is always busy. Hundreds and hundreds and hundreds of thoughts at one time. None of the thought is actually seen as a priority. None of the thought is thought through properly. So you have a very busy mind where you have head is full of thoughts, and very imaginative one, very creative one, hundreds of ideas, but none of the ideas see the light of the day. And the reason is very simple. It's just too busy, too much traffic. Now, as a consequence of a busy mind, three things happen. One, you can't focus and pay attention to even something very, very important. There's too many things. How can you focus? And the focus is bad to the extent that even the conversation, normal, ordinary conversation, the mind, the head zones out. It is somewhere else. Only picking few words between the conversation. You have to repeat, you have to explain, you have to make sure that the attention remains there. Otherwise, mind just wanders around. It just wanders off anywhere. So, the first thing is that because of the being a very busy mind, paying attention and concentrate on something or focus on a task becomes impossible. Other issue, the third issue. The second issue. The second issue is memory. You won't remember anything. Why? There's nothing neurologically wrong there, but memory is poor. Memory is poor in the sense that it's, when we talk about memory, we talk about as a one big thing. In ADHD, the memories for the events remains there. You went on a holiday, you remember that. Procedural memory, if you have learned a task, you will do the task. You won't not remember doing that task. Yeah, and a lot of times actually I've been, some individuals who come to see me, they said that, doctor, I have wonderful muscle memory. So that is also a term used for that, muscle memory, that I can do things. So when they are doing things, they remember those things. So memory is perfect there. And that's what confuses people, that you remember so many things. You remember so many things, but when I talked to you yesterday about something, you don't remember that. Because the working memory struggles to retain a lot of information. The conversational information like I'm leaving home for work, I got to have my wallet, I got to have my keys, I got to have my mobile, all these things got to be with me to be forget. I have to come back to pick those things. For children, PE kit, books, pens, water bottle, shoes, whatever they take school, there is always something missing when they come back because they have forgotten picking it back. Yeah? Or if they've taken their iPad and you're visiting a relative's or a friend's home, the child will come back with no iPad. Where is gone? Forgot to pick it up. Yeah? This type of memory issues you will see. And the only reason this happens is because the mind is very busy. There is a lot of interference going on with unnecessary thoughts. Hence, you can't remember conversations, you can't remember things. Forgetfulness is there. There is nothing neurologically wrong there. It's just mind is too busy. Then the other thing you see in over busy mind, the third thing which I say is conversational. When you hold a conversation with individual with attention deficit and hyperactivity, they tend to come up with something out of the blue, out of context, and just throw it in the conversation which is not a part of the context which you are talking about. Just out of the blue. Now, why do they do that? Basically, if something comes in their mind and they perceive it as relevant, they fear they might forget that. Hence, they have to say it before they forget that piece of information. And that information is not relevant to the topic you are discussing. So what you see is that I'm discussing something else and something else just absolutely different has cropped up in a conversation and then ended. It just came in, gone out, that's it. But the topic continues. So you see this specific, the typicality of that conversation you can have with the ADHD mind. And forgetfulness is there as well. One of the things which affects their lack of confidence, because we are talking about the psychological side of it, is because of forgetfulness, they are likely to forget the names of people they even know very well. Hence, in a meeting situation, a boss with ADHD sitting at the end of the table forgets even the name of the assistant he has been working for a number of years. And because it brings the mind into a kind of a situation where you get stressed, you become more forgetful. But socially, because they are wonderful people, they are the life and the soul of a party, people believe they are wonderful. They are so confident. They could be a wonderful presenters. They could be a wonderful communicators in a formal setting. They are not. In that situation, they perform quite bad. And everybody says that, listen, I've known this person for 5 years. He's absolutely marvelous. He is the man you can rely on when it comes to presenting stuff, when it comes to communication, when it comes to passing information to others. But when it comes to the formal conversation, forgetfulness kicks in. Hello, thank you very much for joining me. Thank you. It just comes in. And it actually, what it does, it wipes off memory. And then what happens? And what happens is you struggle holding formal meetings or presentations. So formal presentations or formal meetings might not be your strongest point. Yeah. Then what happens is, in psychological level, all these struggles, and sometimes you're aware of these struggles, uh, you start losing your confidence and you start overacting. So, on balance, you start doing things, overdoing things to compensate the inner lack of confidence. And that is why people sometimes takes you as a very overconfident guy, but when put you in a formal situation, you struggle. Now, because you know that you can't complete task and you know that you procrastinate, you can sit for hours to end to prepare your mind to initiate a task. And even when you initiate, you struggle to put an organization into your task. And even if you manage to put that organization into the task, you struggle to complete it. And even if you complete 90% of it, 10% will be a struggle. This affects your emotions, induce lot of frustration. Now imagine you have a very busy mind, the confidence is going away, you are struggling with the task in front of you. What is the possible outcome? Emotional meltdown. A big time emotional meltdown. You shout, scream, throw things, etc., 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 whatever it is. Emotional meltdown. That is why, again, going back to the physical side, when you see getting outburst of energy, getting a burst of energy every so often, and then a period of low, plus emotional meltdowns, makes it very difficult for clinicians to look at the bigger picture of ADHD, rather a simpler diagnosis of emotional unstable personality disorder. And that's what happens. So we have seen that an individual with ADHD already got 3 diagnoses without doing anything. A diagnosis of an eating disorder, misdiagnosed, of course, emotionally unstable personality disorder, and mood disorder, which could go up to bipolar affective disorder. Yeah. Now, coming to the social side of it. Now, in social side, you see them overconfident. I've already talked about it. They will have many friends, but superficial. It's hard for them to maintain relationships. They will form relationships. Relationships remain superficial. They will be the life and soul of the party. You will invite them. They won't organize many social events, but if they're invited, they like to go there. They'll be part of it. There'll be a lot of fun, etc., etc. But there won't be any depth to the relationship. Let's say they move town, they move job, they move house. They will be very hard for them to keep up with the relationships they are already invested in the past. They won't keep it. It is very, very hard to maintain the relationships. So you will see them having huge circle of friends, but actual friends Maintained relationships will be very few, maybe no more than couple of stable relationships. And those relationships are usually because of their friends, not for them, and not because of them, because they can't keep it that way. Then there is another element to it. Imagine if you struggle to focus and concentrate even on an ordinary conversation. Lot of times you you are unable to understand the social context of any setting. So comprehension element of social interaction will won't be there. As a result, they are likely to express themselves more than others, say inappropriate things, talk over other people, cut other people off their conversations, and respond in their behalf, finishing their sentences for them, interrupt them, intrude on them. All these things comes into it. Because the comprehension element of the social aspect they struggle with. Why? Because they have a busy mind. That's all it is. There are too many thoughts there. They know how to behave, they know how to queue up, they know how to control their impulsiveness because they are impulsive, but they have a very busy mind. And that's the reason. And that's the reason sometimes you see their reaction to normal situations could be quite odd. Like, for example, you ask them a normal question, very, very, very simple: how are you today? How was your day at work? Or did your school go all right today? Did you meet somebody? You were talking to your sister. Was there anything specific I need to know? Just simple questions, simple conversation. You see a huge, big response, an emotional response, maybe shouting, screaming, or something extremely odd. Why? Mind is too busy. It has not yet processed the information. And I'm going to hold something on information processing because that is my area very close to my heart. That we got to learn to process information right. Otherwise, our mind refuses to accept new information and end in getting a reaction. I need to read this question. It's a very interesting question. I can get back to you. Is it possible that my IQ has decreased from when I was 18 and now 34 years old? I scored 124 on Mensa as a young adult and now I struggle to get over 100, or it may be due to intellectual neglect. You know, gentlemen, I tell you one thing. You are super intelligent. You are absolutely super intelligent. What actually is happening, your super intelligence is actually clouded by your over busy mind. Your over busy mind is clouding your intelligence. Means I can tell you can do things which other people can't. You are super intelligent. What I've read. It is clouded by over busy mind. And that is my third session. Next session will be autistic spectrum, and the third one will be the management of it. And I'm going to be very clear about the how to calm down your overactive mind, the chemicals, the neurotransmitters work in it. What are the options we have? What are the drugs available? All these things I'm going to talk about. So don't worry about that. You will be a very happy man very soon. Don't worry. Now, where was I? Interestingly. Now, what happens is mind is so busy. Information processing is slow because there are too many things in mind. How to process information? If you can't process already existing, where are you going to get the space to get more information in? Hence, even the ordinary conversation can trigger a reaction. And sometimes children drive their parents crazy by reacting like this. But it's not a behavior. It is just because their mind is so over busy. You just need to do something to do that, to resolve the over busy mind. Now, there's a psychological aspect of it. So we have covered physical, psychological, and social aspect of it. And that is where the overreaction affects social relationships. They struggle to manage to operate within the social network. Yeah. Now, next section is biological. What happens biologically? The first thing is food, relationship with food. And I told you that relationship with food is very much like grazing. Grazing is not because you want to overeat. It is not associated with any body dysmorphophobia or any understanding of body size or any part of the body is hateful. That's not the case. They don't satisfy the criteria for an eating disorder per se. But because the relationship with food is different, hence they are diagnosed as not otherwise classified or not otherwise specified when anyone would diagnose them with an eating disorder. That when somebody comes with me with the diagnosis of bulimia nervosa NOS, not otherwise specified, my mind straight goes to the assessment of attention deficit hyperactivity disorder, because it can't be. There are a number of, when I talk about autism, I'll talk about some fancy eating disorders are also associated with autism, when the food is just, the choice of food is based on texture. I'm going on a bit of tangent here, but whilst I've talked about it, let's talk about it. When it comes to the relationship with food, there are four things we consider in choosing the food we are going to enjoy. Either it looks brilliant, visual, either it smells absolutely wonderful, olfactory, either it tastes absolutely fantastic, or the way food feels inside the mouth. In ADHD, food is just food. They love food. As far as it looks nice, smells nice, tastes nice, wonderful. In autism, choices are based on texture. The way food is felt inside the mouth, the way you feel food inside the mouth. Hence, the food restrictions. These food restrictions don't amount to any fancy diagnoses of eating disorder. They are just part of autistic spectrum lifestyle choices and preferences. Just bear with me, I have another interesting question. Doctor, I am sorry for disturbing. Please let me know if you don't want to answer the question. But if you could answer my previous question, I would be very grateful. I thought I would answer the question actually. Is it okay for adults to have ADHD? My answer is yes. It is very okay for adults to have ADHD. And I tell you a little story, my own story. In August 1999, I attended World Congress of Psychiatry in Hamburg, Germany as a young psychiatrist. I was a trainee. And that's when my love for ADHD and ASD started. And I attended this conference, and the training I attended was actually called ADHD Throughout Life. And I came back. Before then, when I was a medical student, or my early couple of years of my training, ADHD was believed to be only childhood condition. And I know I was trained at the start of my training believing that 5, 6 years old, 10 years old, they grow out of ADHD. It's not true. When I attended that course, I came back, joined my training, was working in a hospital in the north of England. And I talked to the consultants. I talked to you, that's the concept I have brought it. I'm trying to understand this better. You know what answer they gave me? He said that ADHD doesn't happen throughout life. It is an American gimmick for insurance purposes. That is the response I got at that time. I remember the words I've heard at that time. And I said, no, it's not possible. It is not possible. Years and years later, Institute of Psychiatry in London started establishing the work. So I did my training from there even before the website UCAN, UK Adult ADHD Network, was actually established. It was pre even the UK website of UK Adult ADHD Network, UCAN website. So I firmly believe that I have seen a 72 years old lady, very accomplished, with a PhD, ADHD. I have seen a 74 years old man, very accomplished, with ADHD. ADHD does not let you to stop progress unless you want to. And that is where my talk is. Neurodiversity is a favorable thing, it's positive. It gives you energy. It gives you ability to do wonderful things. But don't let yourself bogged down by what people say. Don't let yourself bogged down because few friends have disapproved you. It's nothing. Life is greater than that, bigger than that. We're going to talk about it. Don't worry, I'm going to talk about it in a minute. In one of my conversations. So I was talking about the eating side of it. In autism, food choices are texture based. In ADHD, it's not. But eating disorder is usually not the part of their clinical presentation, it's a part of the original root cause of either ADHD, ASD, or in whole general neurodiversity. Now, so that's the food. Sleep. Very occasionally I come across someone who sleep comfortably with no disturbance in neurodiversity. Specifically speaking about ADHD, typically individual experience initial insomnia. You go to bed, you struggle to calm down your mind. You struggle to calm down your mind, and it takes you a few hours to fall into sleep. Technically, clinically, this condition is called initial insomnia. So you get less sleep at night. Sometimes sleep is interrupted. Sometimes you wake up early, or mostly you takes a while to wake up on time. And then during the day, even when you are in the middle of something, you get intense desire to fall into sleep. So you'll take a nap. That is a typical sleep-wake cycle of an ADHD mind. Now, whilst I'm talking about it, I give you a very simple treatment, simple method, simple strategy, which will help and benefit you. I know an hour is over, but doesn't matter. I need to complete the subject. because people are listening. There are plenty of people who are listening and benefiting from this conversation. So I need to finish this conversation as I prepared in my mind. Yeah. Now, in ADHD, what happens is in our mind, there is a small gland lying somewhere. It's called pineal gland. Pineal gland, its job is to secrete melatonin. And melatonin is a hormone responsible to regularize and stabilize our sleep wake cycle. That is the simple concept. Yeah. Under ordinary circumstances, our mind has instructed the pineal gland when to secrete melatonin, how much to secrete, when we are going to fall asleep, when we are going to wake up. So our sleep-wake cycles are relatively stabilized cycles. In ADHD, the first thing you see is sleep problem is always there. I talk to parents when I take developmental histories. They tell me that since birth, this child has driven me crazy, not slept on time. And they tell me all about the sleep issues even with the newborn, and how difficult it was for the newborn. Sometimes it took years to get into sleep-wake cycle and recognition of day and night difference and all that stuff. What's the solution? Dark amber glasses. Go on Amazon and just type dark amber glasses. Type amber glasses for sleep. Amazon, type amber glasses for sleep. Pick the cheapest and the darkest and start wearing them for half an hour before bedtime. Your sleep is resolved. Sleep problem will be resolved. And I tell you why. Amber glasses, amber glass, blocks blue light. When you block the blue light wearing amber glasses, it activates pineal gland, and pineal gland will start secreting melatonin. In half an hour, you will start yawning. If you wear these glasses for 6 to 8 hours, 6 to 8 weeks regularly, if you wear these glasses for 6 to 8 weeks regularly, half an hour before your bedtime, your sleep wake cycle will be regularized, stabilized. After that, you can use these glasses on and off when you feel like, but this is the magical treatment without any medication. Don't get yourself hooked on tablets and medication. Lot of times you get sleeping tablets, benzodiazepines, one with diazepam, lorazepam, one way or another. They work on a different chemical system. Their pathway to work in brain is different. In ADHD, we need to train pineal gland to secrete melatonin at the right time, the right quantity, what you need to be in. Now, I have got a question. Let me read that question. Dr. Hashmi, I suspect I have ADHD. Non-stimulant medications haven't helped, and I relate to issues like poor memory, lack of focus, and inconsistent energy. Yeah, worked 10 hours past 2 days but didn't do anything today. I'm concerned this will affect my exam performance. What do you suggest I do? I personally recommend you need to have proper formal assessment. Diagnosis needs to be established on the good clinical evidence. Yeah. Now, non-stimulant medication is only one aspect of it. There are stimulant medication and there are standalone drugs. In my 2 weeks from today, I'm going to talk about the medication. Antidepressants, antipsychotics don't help because their chemical system, they work in a different systems. They don't help in it. And a lot of times it presents with anxiety, depression, misdiagnosis. I'm going to say in a minute that ADHD gives a lot of frustration and anxiety. So it is diagnosed with anxiety. Sleep problem, as I'm talking about sleep problem, you go to uh, doctors, they diagnose you with depression. Getting a diagnosis of depression and having an prescription of antidepressant is much more easier than buying a loaf of bread from your local supermarket. Trust you me. And then you get the news and a lot of studies that so many percentage of people are on antidepressants, they are not getting better. They are not getting better because their diagnosis needs reviewing. Antidepressants are there to act. They are chemicals. If the chemicals are not working, then you need to look at it. Why chemicals? You need to find a reason. You just can't continue taking a tablet which has not. If you have headache and you take paracetamol, it doesn't take your headache away. Would you still take paracetamol? The same goes with it. The medication is for a reason. You all take medication for a reason. If the medication doesn't help, why are you going to take it? That's the whole point. Now, coming back to the sleep bit, which is again misdiagnosed as depressive disorder. So, how many misdiagnoses we have made up till now? At least half a dozen. Anxiety is also very common. Pick a pair of dark amber glasses, start wearing them for half an hour before bedtime, speed up your pineal gland secretion, melatonin. Melatonin naturally secreted. You are not relying on any drugs for your sleep. Your sleep will be organized 6 to 8 weeks. After that, just use it when you need it. Yeah. Now, I'm going to talk about another question in a minute. Another little gadget I tell you whilst I'm talking about this amber glasses. Foot massage slippers. Foot massage slippers hold magical resolve in ADHD. Why? The mind, although it is full and very busy, it is also in need to attract more and more stimuli. In simple words, the sensory need is very high. And that's where the distraction comes in. You are distracted by every little sound, noise, or anything activity happening around you. Even little click somewhere, you are going to be distracted. That is the need for sensory input. Can you see how difficult day is for an ADHD if it's not managed effectively? That mind is busy, unable to get any more information, and there's a huge sensory input from all the stimuli. Total distraction, constant distraction. I have a simple solution. Get a pair of foot massage slippers and start wearing them. And why am I saying that? Trick your mind into the sensory input you provide instead of the mind picking the sensory input by choice. So you wear these slippers, foot massage slippers, or soft spiky slippers, which actually give a little sensations underneath your feet, the sole of your feet, which is quite sensitive. Uh, There's this very simple question. No, actually, if you look at and search on probably Amazon, they don't only use these glasses, they actually have a clip-on as well. There are options for clip-on. So you can actually, if you are wearing glasses like me, then you just can use the clip on your glasses. So the same glasses with the amber glass on the front of it. Just buy the cheapest and the darkest. You don't go for fancy because you don't. I'm not going to recommend any specific brand or anything, but just go for the cheapest really. Yeah, that's what I would do for myself if I need to buy amber glasses. Now, coming back to where was I? Coming back to sensory need. Yeah, if you wear the glasses, then feet are usually quite sensitive in ADHD. Feet massage is the best thing which could happen to an individual with neurodiversity, specifically with ADHD. You put the slippers on, wear them whenever you are walking. It will make you feel calmer. Take my word for it. It will make you feel calmer. It will reduce your distraction from the external stimuli. And the third interesting thing it will going to do is you will not need to rely on a parallel activity to undertake an activity. This is also very common in ADHD, that the music must switched on for me to read this email. There got to be something in the background. You see the discrepancies of mind, the way mind is playing with us here. It's full, doesn't want to take any more information. Information processing is an issue. Is still getting distracted by all the stimuli around you, as well as there is a need for parallel activity in the background. So something must happen in the background for me to be focused to do something. It's amazing. By wearing these slippers, your mind will be tricked into a state that your sensory needs are being satisfied through your sole of your feet, which are already very sensitive. It calms down. Your distraction level will reduce. The need for parallel activity, background activity to focus on an activity will reduce. You will be able to sit for longer and work for longer. There are non-medical strategies I have picked over the years whilst working in neurodiversity with individuals who have come to me to ask for support and assistance, and I've done my best to help and support them as much as I could. So I have picked over the years that these little things have helped. If you want, you can buy a cushion as well. There are a number of cushions with a lot of like you could feel things like spikes on it. Plastic is a very soft spike. You don't really need, the softer spikes on it. And there are cushions on there. You can sit and use that cushion, and it also will make you feel a bit more focused and concentrate when you're sitting in chair working. So then we've talked about food, we've talked about sleep. What other things we need to do? ADHD has some link with gastrointestinal system. There's another misdiagnosis coming up in a minute. Irritable bowel syndrome. Because GIT sometimes doesn't work the way one expects it to work. There are some research studies which have shown that in ADHD the bacteria, the gut bacteria profile is different. Yeah? And lot of times there is hidden condition called celiac disease. It is always good, if you suspect you have ADHD symptoms, get your celiac test done. Celiac disease or celiac condition is entirely gastrointestinal problem, gut problem. Yeah. Get it tested. If it's negative, put it aside forever. You don't have to worry about it. If it's positive, you will be able to discuss with your doctors to do something about it. I can't talk much about the condition because I am not a physician. Yeah, and I have to keep in my area of expertise. But celiac condition, celiac disease is linked with ADHD. If you have ADHD symptoms, must get celiac tested. If you are negative, you can put it down on this one side forever. You don't have to worry about it. If you are positive, discuss with the physician how to manage it. Then, ADHD also linked with asthma, some allergic conditions, mainly allergic rhinitis. So your nose is blocked and more allergic and more sensitive to different things. Eczema, your skin condition. So in ADHD is more common individuals to prone to develop eczema. Sometimes they can develop some involuntary movements or sounds um, out of context, which is again associated with ADHD. So bear in mind that ADHD has some physical uh, conditions which I generally cover in the biological side of the condition of ADHD. Now the environmental element, the last one I discussed, environmental element. Now environmental element is that a disorganization will be the feature of it. Let me see if there is another. But doctor, what if someone already has glasses? That means they cannot. I've already answered that. Doctor, what do you think about fidget toys? Ah, wonderful, wonderful. You can use fidget toys. It's very good. Fidget toys or anything to hold on as a fidgety, all helpful, all helpful. Uh, but you cannot match the outcome we see with treatment with medication in ADHD specifically. Uh, ADHD can very successfully be managed by medication, although two prescriptions are never the same. I was holding on this thought for a later date, but whilst the questions I'm getting, sounds like that a lot of individuals are assessed only for ADHD, not for autism. The assessment of autism and ADHD got to be together because the conditions are parallel. Very often they are parallel. It says 40%. I believe it's far more than that. I occasionally see somebody whom I see as pure ADHD or pure autism. I always, 95% of time, there is an overlap, one way or another. And I'm going to talk about it in my later conversations on this. If you manage to establish the proportionality of the overlap, that proportionality informs the medication, the prescription. You cannot write a conveyor belt prescription just by doing few tests in ADHD and say this is the rubber stamp diagnosis and that's you go, that's your prescription, take a brown pill every day and you will be fine. You cannot do that. You got to assess an individual as an individual. You got to establish the proportionality of attention deficit and hyperactivity disorder and autistic spectrum. And that proportionality informs the choice of medication, the combination of medication, stimulant, non-stimulant, standalone drugs, all can be mixed in different settings, different proportionalities, different percentages. It's all allowed. It depends on individual clinician's experience though, because there is little research around it. The reason research is minimal because a lot of these drugs are now unlicensed. They were licensed to start with. Drugs used to get licensed about 10 years. Now they get a bit longer. After that license, anybody can make these drugs. So these drugs are generic drugs. Who is going to spend millions on doing those research? Unlikely. So a little research, but individual clinicians' experience is brilliant. There are plenty of good doctors out there. So proportionality informs the choice of medication and its combination. Now, coming back to the environmental side of it, in environmental side, what you see is disorganization, haphazard things, specific organization for certain things, not letting anybody enter their room, not letting anybody change their bed sheets or even bring any disorganization to organization, timekeeping, time perception, timekeeping always out of control. Either they are too early or too late, usually too late, because of procrastination, because of their time perception reason. Time perception is basically if a train station is 10 minutes walking distance from my house, and I know it's 10 minutes walking distance, I should be leaving about 15 minutes early so that 10 minutes I can walk and 5 minutes to get onto the train. Yeah? An ADHD mind will give 5 minutes to 10 minutes walk. And that's how it is. So the time perception and time keeping, then you ask them, how long will it take you to finish this work? Because I need to see you. Or how long will it? And they'll always give you time which is with the wrong estimation. That's time perception. Sometimes you just sit there, look at the clock, 2 o'clock, and then next time 4 o'clock. Oh, yeah, 2 hours have gone, I have not done anything. That type of time perception I'm talking about. So time perception will be an issue, disorganization will be an issue, their room will be an absolute mess. That is the environmental side of it. Yeah. Now, so we have covered today attention deficit hyperactive disorder to a larger extent. We have looked at the physical, social, psychological, biological, environmental fact, environmental, all these aspects, the way ADHD is comprehensively presented in a situation. Yeah, we have looked at the several types of misdiagnoses, start from anxiety, from depression, emotionally unstable personality disorder, eating disorder, not otherwise specified. We have actually also looked at uh, emotional and the bipolar affective disorder as well. We have looked at the physical health issues associated with the condition or places someone at risk of it. And then obviously we have talked about amber glasses and soft spiky or foot massage slippers. So that brings to a closure to ADHD. Next week, the same time, 7 o'clock, I'm going to start talking about autistic spectrum as the lifestyle choice, as the way it is. And then the third conversation will be on the management. If there will be a need for further conversations on this topic, I would love to do that. It is one of the areas of my expertise which I love to talk about. So if anyone wants to ask any questions, I am more than happy to answer. I think I have answered all of the questions which were sent to me during this conversation. But please do let me know if you have any questions before we bring it to a close. I think next uh, talk I will make it 1.5 hours because I think that's more realistic for such topics instead of limiting it to an hour. Okay, so if there are no more questions, I would love to bring it to a close. Thank you very much for listening, and I wish to see you guys next week, next Saturday. But I have scheduled other conversations as well. I will be holding another conversation on Monday morning, UK time, between 4 a.m. to 5 a.m. That's quite a good time for me because I generally wake up early and start my work early. And I'm holding another conversation on Wednesday at 7 p.m. So, watch the space. Okay, you. Thank you very much, and we see you next time. Bye bye.